be live on YouTube for anyone who wasn't able to join us in this webinar. There'll be a place for them to ask questions there as well. Okay, so we're going to go ahead and get started. Welcome everyone to our special session of our Webinar Wednesday. I know it says Webinar Wednesday, but we wanted to make a really special session for our military personnel, veterans, and their family members, because there's a really unique opportunity here for our students in the Health Services Administration program. So welcome. Colin, go ahead and go to the next slide. Just as a quick introduction, these are our panelists. They'll each introduce themselves in a deeper manner to let you know their background. But we do have Dr. Larry West, Shannon Elswick, Deepika Patel. We have Joshua or JJ Johnson. And then we also have Colin Van Meter, who's going to end up being our moderator for today. My name is Katie Terry. I'm just the director behind the scenes today, giving you a little bit of background information and being here for your questions. As we go through, if you have questions, just go ahead and type them out in the chat. We'll be feeding them to the panelists at the end during the open Q&A session. But feel free at any time to type it in the chat. We will keep it accessible, and we will keep track of them so that we can get them at the end. Same for anyone watching live on YouTube. There is the chat function open so that you can ask your questions there and we can feed it to the panelists. Go ahead, Colin, to the next slide. So first, just a quick overview for anyone who's brand new to the Health Services Administration, not really entirely sure what it is. Essentially, it's the business side of healthcare, right? So everyone thinks of healthcare, they think doctors, nurses, technicians, but there's a whole other side that we're approaching, which is the administrative, the business side, working on the customer service side, the patient access. Healthcare is more than just treating a patient. It's doctors and nurses working together with the administrators to treat the whole person and keep you well. There's some quick facts here about the percentage of what like the health services managers, the percentage that takes up the healthcare industry. And essentially the skills that are developed are critical thinking, communication, healthcare information analysis, leadership, and of course, it'll prepare you for running efficient healthcare organization impacting community outcomes, which ends up being something that's really lucrative for those that are military personnel, veterans, etc. So now I'm going to pass it off to the people of the hour, our panelists, and this goes to you, Dr. Larry West.
Okay, hi, that's me. Welcome to everybody. I assume everybody here has got some connection with the military, and you're here because of that, maybe not. So just a little bit about me that's got to put the core of what I want to say is on the next slide. So I had 28 years altogether of military service. I had 10 years active before my wife got tired of the military healthcare system for dependents. Did 18 more years of reserve duty, which included mobilization for the invasion of Iraq, where they attached me to the Marines of all things. So I had, as part of that career, I started as a second lieutenant. I went through ROTC. And so I had leadership jobs of all sorts. And kind of the capstone here was serving as a chief of staff, where I was supervising. If you sort of look at the credentials of the people that reported to me, the reason I wanted to emphasize that is because this is going to come back again to the next slide, where I'm going to talk about some of the big things you all have to offer an employer, including ways you might not think, oh, we're on the next slide. Okay, so guys, no matter what you might have done in the service, I started out in the infantry. I spent 10 years in the infantry and then did other things. Once you go in the reserves, you do other things. But no matter what it was you did, if you got to be a corporal supervising 3 people, You had leadership experience. And one of the things you may not realize, if you've not worked in industry at other than a very low level, is how far ahead of the game compared to your peers you are because of the leadership experience you probably had in the military. I mean, it's hard to get through a 3-year tour, unless you're a total screw up, without being put in charge of other people. And so you have already gone through some of those traumas of screwing up with leadership, of having to counsel people, having to motivate people, learning what works and what doesn't work. And by the way, one of the reasons that I put that previous set of slides, the kinds of people that I was leading at one point, is it many of the civilians you might communicate with, their vision of military leadership is Lee Ermey in Full Metal Jacket yelling and screaming at people. And you all know that, yeah, maybe there's some of that going on, but the modern military is so technologically uh, intensive, and the quality of the people, the Army made the decision a while ago to just, no matter what their recruiting shortfalls might be, they were just not going to accept the low-level applicants. And so you've been dealing as leaders, assuming you had leadership positions, you've been dealing with quality people and learning how to do that. And again, you probably screwed some things up. On the previous slide, I said the hardest job I had was an infantry second lieutenant platoon leader, brand new. Boy, that was a mess. And again, looking at the second big bullet here, most of your peers do not get to leadership positions until much deeper in their civilian careers than you might have had. So this is a very valuable thing you're bringing to the table, and you need to recognize that and communicate it. I've got a couple of little bullet points of things you can add to your resume, assuming you had any kind of leadership position. So the first one, some of that language there, welfare, training, and performance of a team. Those are key buzzwords, and then you fill in how many people were in the team. Depending on your experience, if you had the experience of supervising people through one or more layers of subordinate leaders, that's even better. Where now this is a valuable commodity that you're bringing to the table, and it's important that you be able to communicate that. And it's really important, guys, that you not discount it. Oh, it was in, I was in an artillery unit, or I was in a Coast Guard, small boat of some kind. It doesn't matter that it had nothing to do with healthcare. Leadership has got aspects to it that transcend disciplines, and that's a really important thing for you to understand. A couple of other things down here on the bottom of the slide that you might not have stopped to think about. When I started in the Army, we spent more time in the motor pool maintaining armored vehicles and missile systems and so forth than we did actually out in the field. If you had maintenance management responsibilities where you kept records, you ordered parts, you reported deficiencies, you made repairs, requested support, managed support. Guess what, guys? Healthcare is a technology intensive discipline, and those skills will translate. And by the way, not only is it technology intensive, but they have to document it, they have to manage, they have to plan, they have to make sure that the parts are available when they're needed, that routine maintenance is done. Hope that's probably going to sound familiar to a lot of you. Training and development, if you had responsibilities for doing anything, developing classes, teaching somebody how to do some new piece of equipment or some procedure, emphasize that. This is an important skill that transcends whatever discipline you happen to have been in. And so that's it. I've never worked in healthcare, by the way, but these skills, these characteristics that you probably have are going to be value in any kind of managerial environment. And if you're looking at our program or in our program, that's what you're looking to do. All right, I'll shut up. That's a rarity.
I think it's my turn to go now. My name's Shannon Ellswick, and Dr. West was an 06, a full bird colonel in the Army. I was an E5, a mid-level petty officer in the Navy, and yet we both get to end up in a wonderful position of being able to work with bright young people in the academic environment. So we took two very different paths. My enlistment was 6 years and then back out. But on the left of this slide, you can see only a few of the positions that I held as I was developing my career. But the Navy was a significant milestone for me. And I'll tell you just a bit more about that in just a minute. But I think my colleague has been right on with his assessment of the types of opportunities that you have if you have a military background or if you're pursuing a military career. So I currently serve as the executive in residence, and I'm also an instructor in the program. But here are the things that I think are probably more salient for our conversation today. So I say bedpans to boot camp to boardrooms, and that's the title of my journey. In 1975, I left a very poor showing in college to become an orderly in my local hospital. And after multiple years of that, I joined the Navy, went to boot camp, and boot camp is a very interesting way to adjust your attitude, which I'll talk about in just a minute. But the things that I learned in the Navy were discipline, responsibility, and respect. Those were all things that I lacked before I went into my term of service for the United States. And those are the things that kind of become the core of the character that will allow you to be successful as you develop. All of the people in our Health Services Administration program, especially at the graduate level, you don't have to go through our programs to have a frontline job in a hospital. You go through our programs when you want to be a leader, a manager, a supervisor. I mentioned adaptability just as an example. I was the senior corpsman of a clinic in Jacksonville, Florida at the Naval Hospital. And one day the command master chief called on me and told me that he needed me to basically change jobs. He needed me to stop being a corpsman and become a radioman and figure out how to work a new radio system that we have for all of our branch clinics. And I knew nothing about it. But that switch in jobs was my first shot at creating a sense of, I can do it, right? And that builds through your career. Every time you have an opportunity to do something you haven't done before, it creates that confidence that whatever comes next, I can do that. The Navy also taught me the responsibility of teamwork. And I'll talk a little bit about that in just a second when I talk about leadership philosophy. But the worst thing you can be is in charge of a clinic, which in Larry's case was maybe a squadron or a platoon, but in charge of a clinic when the people that work in the clinic don't show up to work on time, or they're not good at what they do and they don't care about their work. Your job as a leader, as a manager, is to develop that sense of pride and ownership in the work product and to use the team to accomplish the mission. And that's a critical skill that you will learn if you go in the military, or that you probably have already learned. The last thing about that I want to speak on briefly is just planning. So part of my role after we got that radio system up and running for the hospital there on base was to become the disaster coordinator and planning scenario liaison for our hospital for the entire base. So we designed disaster scenarios that we use for all of our disaster drills. Later in my career, when I became a senior executive, I went through some pretty extensive FEMA training to be the incident commander for the entire health system. There's no way to understate the value of planning. And I think that right now in our pandemic environment, those in the industry that had not had extensive work with that and extensive exposure to it have come to appreciate the value of planning. So just a couple of quick things, because I want to leave lots of time for everybody else and for questions. But my last bullet there is leadership versus management. I promise not to give you the whole sermon because we don't have time. But managers manage workflow, they manage process, they make things happen. They're in charge of production. The difference is leaders acknowledge and understand that leaders accomplish tasks not directly, but through motivation of other people, through coordination of the efforts of others. They lead by example, they become role models, they motivate, they inspire. And one of my central themes is, in this world, people don't buy what you do, they buy why you do it. And you don't motivate people with facts and figures. You motivate people with language of opportunities and possibilities. And in the military, the greatest asset that we have is a shared purpose. When we're in the foxhole, when we're on board ship, when we're in the sub as it goes underneath the water, we have a tremendous sense of shared purpose. Those are the types of things that you need to be successful in the workforce. Just like Forrest Gump said, I'm not a smart man, but I was able to get from the very bottom of the healthcare industry to a very high senior position by utilizing the skills and some of the opportunities that I became aware of in the Navy. So core philosophy, everyone should have a management or a leadership philosophy. Mine was codified many years ago when I was asked to give a commencement address. And I knew that I could not remember anyone who ever gave a commencement address at any graduation I ever attended. And I couldn't remember what anybody said. So I knew that my name would not mean anything, and most likely what I said wouldn't mean much unless I could make it really simple. I codified my own management philosophy in this way to say that I am principle-centered, relationship-oriented, outcome-driven, PRO, pro-leadership. And I kept putting that out there. Well, 10 years later, I had someone who had just been elected to the tax collector who was at that ceremony for one of his children, came up to me and quoted that exactly. But simply what that means is all of us should start with a core set of principles. If you want to be a leader, you need to be principle-centered. Then you have to understand that leaders don't get anything done. Leaders motivate other people. So relationship orientation in your quest to achieve outcomes is critical, absolutely critical. In the military, if I outrank you, I can tell you to do something and you'll do it. But if I ask you to do something the correct way, you'll do it better. And that's what happens with that. And then outcomes become critical for anyone in the military or out of the military. You've got a job to do. You have to get a certain number of outcomes from that. So principle-centered, relationship-oriented, outcome-driven. That's mine. It doesn't mean that would be something that you would aspire to, but you should be able to articulate what is your philosophy, your leadership, your management philosophy. The second thing in there is, I think we should all have a value equation. Now, it sounds a little bit academic, but it's not really. And I didn't make this up. I can't even tell you where I got it, but I believe it and I internalized it and I've used it over the years. But quality plus service divided by cost is a very simple equation that I use to measure value in any situation, in my life, in my family, in my outside activities and my board responsibilities and in my academic responsibilities. Again, you don't need that, but you need to be able to know how do you estimate value if you're going to be able to do that. I mentioned attitude a little earlier, and I think attitude is one of those things that all of us have to figure out for ourselves. So if somebody ever says you shouldn't feel that way, that's about as dumb as it comes, because we feel the way we feel. Good things happen to us, bad things happen to us, period. It's not how you feel, it's how you respond to that. And as a leader and a motivator, if you want to encourage other people, then your job is to get up in the morning and recognize that you can't control very much in your life. I could not control if I had air in my tires when I went to work, or if any one of my 3 boys could pass college algebra on their first try. I can't control those things, but I could control how I responded to all the bad things that came up. So we strap on this positive outlook, because, our words, reflect our past. They describe our present, but they predict our future. You got to think about that. Your attitude predicts your own future. And that's true. That's a fact. I don't need to mention work ethic, but the Navy absolutely taught me that work ethic is absolutely critical. And then I'll finish with this last concept on motivation. And I already mentioned it, but people don't buy what you do, they buy why you do it. You have to inspire people. You can lead them through your encouragement and through your position, but the way to really move people is to motivate them, to inspire them. And you do that with some of the soft skills that we all had to learn. Last thing is simply this. I came out of the military as an E5, which, I had to have a 6-year enlistment to be able to do that. But I came out of the military with no degree. I had not finished my college degree yet. I went into the healthcare industry as a manager. I had 60 employees. I was young. I had a shaved head. I was a punk. And all of these older people were supposed to be taking orders from me. But because I had developed those skills in the military, I was able to handle that job and then move from that management job to a trauma center to business manager and on up the line. I attribute the Navy for all of those skills. And speaking of, sharp, young men with good haircuts, it's my pleasure to be able to introduce Colin. Colin is graduating in like 2 days and will be commissioned into the United States Navy as Medical Service Corps officer. And he is a perfect example of the type of future leader that we need in our military, and I'm sure he's going to do wonderful things. So Colin, let me turn it over to you.
All right, well, thank you very much. So yeah, I was happy to hear that I could come get to talk to everyone. For everybody that's already served, I'd like to thank you for your service real quick. And I'd like to talk a little bit about my backstory. I'm about to turn 30, so I've got a little bit of a different story. I'm also in a master's program while I did ROTC. I'd kind of like to talk about how that balance ended up working out for me, for anybody that has any interest in serving in the military as a healthcare administrator while doing this program. So I guess to start off, just kind of a little bit of backstory. I decided to go to UCF because I had really a limited experience in healthcare administration. I had, right after my undergraduate in 2013, I decided to go to a chiropractic school. And I was there for a little bit. It wasn't really, I wasn't getting out of it what I wanted. And so after about 6 months, I had decided to leave. And I decided to kind of look around for something around healthcare that I thought would be a little more interesting. I'm more interested in sort of the administrative side, with the finances and the technology that goes in behind the scenes of healthcare. And so while I was here in Florida, I was kind of just working as a server, trying to figure out how to go about getting into this industry. And I thought going back to school would be the best way. I knew that this program, one of the big things that I was interested in was that this program places a huge emphasis on making sure that you're set up with a solid internship towards the end of it. And so I thought that was really interesting. I liked the fact that I'd be able to work while I'm in school. So the flexibility of the classes I thought would be really helpful. Almost all the classes that I took started at 6 p.m. and ended at 9, and they were every other week. So being able to balance that with ROTC was actually pretty easy, as for ROTC was primarily in the mornings. I thought that it was really cost effective. As I had said, the prior school that I had attended for a little bit was significantly more expensive, like a lot of fields, or like a lot of areas within the healthcare field. That schooling tends to be a little more expensive. Here, I felt like the cost was great. They met the standards. I felt like a large university like this would bring in a lot of great professors that I'd be able to get to know and learn a lot from, as to where any of the private schools or going out of state might offer the same thing, but for 2 or 3 times as much. And so that was something that I had definitely considered. While I was in graduate school, my first semester, actually, I had talked to a few different professors, Dr. West being one of them. And I was trying to figure out a way to set myself apart from my classmates. And I had learned a little bit about military programs. I thought that they were really interesting. I started looking into them more. And I found that the Army ROTC program would give me that best opportunity in becoming a healthcare administrator for the military, and giving me that ability to set myself apart if I am to do one contract, or if I'm to make a career out of it. As to I guess compared to most of my constituents that I'm in the classes with. Some of the benefits that I was able to get out of ROTC were obviously, the scholarships. I was able to gain a lot of recognition through this. I was able to get to know a lot of the staff, as for many of the staff are prior service, and kind of get to know them, understand their story, and gain the most out of that. The program I thought was really military friendly, the MHA program. All of the professors and the faculty were able to work with me on my schedule. So the summers, the first summer I had to go to a basic camp. The second summer I had to go to an advanced camp. This program runs 3 semesters through the year, and the staff was able, and the faculty was able to work with me in designing a program for me over the summers, to where I could continue to take classes, but also go to these camps and any sort of weekend trainings that I had, which was great. And some of the internship opportunities that I got out of being able to do ROTC with doing this program were really interesting. So one of them that I was able to get that many of my other classmates wouldn't have been able to get otherwise was an internship with MOA, which was the Military Officers Association of America. So I worked at the local chapter here. I thought that it was really interesting to be able to meet different people through that organization, people that are working within this area still, all of them veterans, or even that are currently active duty. I was able to work with them as well, get to know them, get to understand their backstory, to where I could further my career, whether it's in the military or outside of it. One of the things that I'm currently doing with the internship is we're, I guess, setting up a meeting with the Congresswoman Val Demings that's in the area. And so we're still currently in the works of setting up a meeting with her. So it's come up with many opportunities that I think my classmates wouldn't have otherwise been able to work on. I also was able to have a second internship to finish out my hours, because you have to get 240 hours when you do your internship. So I had split it up into 2. The second internship I did was with the HMI internship director. Sorry. And I was able to essentially kind of hone in my skills for IT. He taught me a lot about different things that, more advanced features I was able to use in Excel. Really, essentially just different skills that I could use in the future here. So I thought that working with these 2 were great. I felt that what I had learned as a cadet which was mostly leadership training, I was able to transfer over to a lot of my classes. I think the days that I showed up in uniform, I gained a lot of notoriety, I suppose, when I would work in different groups, and vice versa. I think coming in as a graduate student into ROTC, it brought a certain level of respect, I suppose, right off the bat, that I was able to use, and I was able to, I guess, project my voice and become a better leader that way. But other than that, I appreciate you guys' time. I'd like to turn it over to Ms. Patel. That'll go over the Orlando VA a little bit more.
Hello, welcome. I did respond to some of the questions here, but I know we have a little bit of time at the end. So currently I work at the Orlando VA. My role there is a health system specialist. And what I do is, so I am a system redesign coordinator. I do a lot of work with process improvement. So if you can go to the next slide. Perfect. So those that don't know a lot about the VA, so I just wanted to give you guys some kind of high level information. It's the largest integrated healthcare network in the US and actually the world. We serve 1,255 healthcare facilities serving about 9 million, and actually it's growing every year, veterans every year. And our mission is to fulfill President Lincoln's promise to care for him who shall have borne the battle, and for his widow, his orphan, by serving and honoring men and women who are America's veterans. VA carries out specific missions to make a good commitment. So there's different tenets of the VA. So there's the healthcare, the VA, like the healthcare part side of it. There's also the veterans benefit arm of it. There's National Cemetery, which a lot of people don't know is under the same umbrella. And then we also have a fourth mission, which we are like right now invoking a lot. And I don't know how many of you really know about how the VA is helping with like the community living centers, and right now related to COVID. So we are invoking that, and we are supplying our staff, getting our staff to kind of help out the community. Also, we've taken folks, and many of you may not know this, but like we've taken patients in the community. So if the surge, as we all know, is kind of like growing here in Orlando, we even take patients that are non-veterans. So that's something that's unique. That's usually is not part of our thing unless there's a pandemic or something crazy going on, like currently. Even when there's hurricanes and things like that, we also help out the community with those needs as well. Next slide. So just an overview. So I'm a health system specialist. I've started really in the process improvement world in 2011. Prior to that, I started in the VA in 2008, where I started as a TCF intern, and I'm going to talk a little bit more about our internship programs that are a good way to get into the government, any federal positions. I am a U.S. Army veteran. I was a medic in the past, and I did my master's in healthcare management. And I'm also a Lean Six Sigma Black Belt. So that's, which brings me to what I do. So I conduct trainings for our staff. At the Orlando VA, we have about 4,300 staff. And we also have like outlying smaller locations, smaller clinics. So we support their training as well. So we have a large group of employees that do work here, and it's growing and growing as Orlando's growing in terms of population size. And we actually have a lot more uniques than Tampa does and Miami. So we're the second highest. So the way the VA works is it's kind of like there's regions, and which means for us in the VA is a VISN. So a VISN equals like a region. So we have all the Florida main cities like Gainesville, West Palm Beach, Miami, Tampa, Bay Pines, and then we also have Puerto Rico and the Caribbean. So they're all part of our VISN, so our region there, just for you guys to learn a little bit about our lingo here. Some of the other things that I do, I facilitate projects, I mentor our belts and also mentor their projects. Project management is a key thing that I feel like I do a lot of. Innovation. So as we're working through process improvement ideas, people may have come up with any innovations that they want to do. So there's a pretty robust innovation program within the VA. A lot of people don't know about like some of the innovations, but a lot of the prosthetics things, PTSD solutions and research, we are pretty strong in our research department and really focused on the veterans. And I think that's one of the greater benefits of working in the VA if you're really passionate about helping other veterans. And that's really why I chose to work there. And then I support other national initiatives. So being in a system that's so big, there's always these national initiatives that are going on that we're all trying to kind of learn from each other, learning best practices. And then we all share the same medical record system. We're going to be going to Cerner soon in the next couple of years. But right now and that will also be shared, but right now we have our homegrown CPRS system where we can get so much data. We can compare different level facilities, complexities, and so forth. So lots of information, lots of learning and ideas and sharing amongst our group within the national like VHA system. So it's pretty awesome in that way. We learn a lot. You have a question, you just reach out to a mail group and you can get a response. The other benefit of working in the VA is that since we have so many sites, like if you need to move, there's most likely a VA in that other city that you're going to. And I feel like it's easier to like change like your whole profession, right? So if you start off in one area and you can kind of build nurses specifically and social workers like often jump like total different lines of what they do. And then there's a lot of national positions also. So lots of opportunities in terms of growth and development. Next slide. All right, so this is an overview of kind of the different internship programs that we offer. So typically, and I'm also a preceptor for UCF students in the master's program. Usually it's in healthcare administration or informatics. And then we also have another school that we work with as well in terms of internships. So those internships where it's for students that need to get credit for a class is what we typically have in terms of a walk program. There's also other opportunities that you can find on usajobs.gov. There's a technical career field internship, and that's how I started in the VA. It's a paid 2-year internship. And basically at the end of it, there's like a contract that's signed. Like, so with the facility that you're doing the internship with, you basically get a permanent position if everything is well with your performance, that you would attain a permanent position, which is pretty awesome. We have another program, it's called the GHAP program. And it's typically a 1-year program, but it's for enrolled students. And then we have the Pathways programs, and there's multiple different types underneath the Pathways program. But these are all paid positions. They're either 1 to 2 years or 2 years. And even like the regional office will recruit Pathways. So it doesn't mean that you have to be working in a facility. It could also be, you could be in a whole different section in not like at a hospital. You could also be working at an administrative office at a regional level. So there's lots of different opportunities with that. Next slide. So different tips for success. So the funny thing with the federal jobs is when you apply and create your resume, usually in private sector, they're supposed to be like 1-pagers. They don't want you to make them super long. But the thing with the federal system is that the longer the better, because what it goes through an electronic process where they're looking for keywords that are related to the way that the job is posted. So that's just a tip for you to know. It's hard because it's like you don't want to have this cumbersome resume, but in order to even move forward in the process, you have to pull all of your experience. And it goes back to like what Shannon was saying and Dr. West was saying, take some of that military experience and translate it into what it is. If you want to make sure like, hey, if you saved money, put that in there. If you were able to show some outcomes, put that in there, because people are looking for more action-oriented resumes now. It's not just like, hey, I worked at this clinic and I managed this department, but what did you do? What was the outcomes of what you did? And so I think that as a reviewer of a resume or even in an interview panel, we're looking to hear those things. We're trying to see, you want to turn in your experience into more of an action thing so we can understand like what your potential is. And a lot of times we don't think of ourselves, like if you've been in the military and if you are like a sergeant, you don't necessarily think like, hey, I manage this group of like this platoon and I was able to do this and I was able to make sure that even like those things like with the motor pool, that's definitely like preventative maintenance and how you're able to apply some of the standard work. And you have to think of things in a different way to make sure that it flows with what the job posting is for. And then in internships, like I said, I'm a very big supporter of internships, like within any government or entity there, because it's a great way to learn. You want to obtain any certifications in the fields that you're interested in. So RHIA, RHIT, any Lean Six Sigma training, if you're into like process improvement world, as being a student, this is a time where you have all those opportunities to kind of obtain those certifications. So you should go ahead, the PMP, project management. So different, look at those because that will help your resume be a little bit more stronger. And the other thing is, I think we're looking for folks that are involved in different aspects, like you're not just like totally academically driven, but maybe you're volunteering at a shelter, or you're doing other things. And then you're also maybe involved in ACHE, for example, or IHI, you've attended or you're part of a chapter. So you want to look at all the different opportunities there are out there in the community, because you might pick up a skill. You might be part of a board. You might be able to, show your leadership in a different way that is reflective in a future position that you're looking for. And some of the characteristics, a lot of things that we look for in selecting an intern or selecting a candidate for a position, we're looking for flexibility. Look at the situation now with this COVID. We have people deployed in totally different positions. Like currently I'm deployed in a COVID planning situation where we're planning plans for, how do we deal with the surge? We're actually right now, we're planning for a crisis situation. So what's our next location of where we can expand beds? Like, so I have to use my brain, not just in like what I know, but applying what I know into something totally foreign, right? And so we're looking for people that can actually do that. And the way that we understand that they're able to do that, and I think one of the other speakers was touching on this, was through like your experience. Like, what did you do and how did that relate to, taking on something you knew nothing about and then being successful in terms of outcomes? I think Shannon was talking about his story where he touched a little bit on that as well. Tech savvy folks, because everything is going like with technology, being able to do pivot charts, being able to like know Minitab, understanding like how you can work things and showing charts and graphs and applying your skills into more visual management that people can understand and relate to. Positive attitude, I think, is like the biggest thing that we're looking for, because who wants to work with somebody who's not like positive and willing to do things outside of like their normal work, right? We're always looking for that positive energy. Willingness to learn, that's a given. Reliability, and then some confidence, and I think that's one thing that the military has definitely given me when I was through being in the Army. It's like you think of all the crazy things that have happened that you endured in that situation, and you're like, there's not a bigger problem going on right now that I can't handle. You know what I'm saying? So you have to apply that confidence into whatever you're bringing to the table. So I think that's really important as well. All right, I'm going to hand it off to the next speaker.
Good evening. My name is Joshua Johnson. I also go by JJ because there's so many of us at UCF. I currently serve as the Student Resource Specialist 2, long title for basically Program Coordinator, Program Manager for the Veterans Academic Resource Center. I've been with the university for roughly about 14 years. I've been with the VARC for about 6. I am not a vet, but I am a 23-year Air Force brat. My dad served in the Air Force for 23 years stateside. He was never deployed. So that's a little bit of background on me. I'm gonna try to go through some of the things really quickly because I wanna value everyone's time, and I know this was from 5:30 to 6:30. But again, the Veterans Academic Resource Center is was established on Veterans Day in 2010 as a place for our student veterans to feel comfortable, to have that third home aspect, and also to serve as a resource. University of Central Florida, we're a big institution with well over, I believe, 78,000 students, making us the second largest institution in the United States. So, with a large institution, there's a lot of resources and a lot of places to go that do one thing. So we wanted to have a place, or like a third home. We currently serve over 2,700 of our student veterans and dependents. About 1,300 to 1,400 of those are student veterans who are going through one of various majors or dual majors or whatnot. So some of the things that we have, were the picture up there kind of have on there. We're located right over on the northern end of campus, so where the UCF, where the Addition Financial Arena is, right around the corner from the ticket office next to Jimmy John's. So some of the things that we offer within, I would say, amenities that we offer for our student veterans specifically in our area, we have dedicated lounge space. So our veterans can come, hang out, interact with other student veterans, watch TV. We watch a lot of bad TV there. We have a refrigerator and a microwave, so veterans can drop their meal off and cook, their lunches, or have lunch while they're hanging out. We also have dedicated study room space. We have 4 quiet study rooms that are dedicated specifically for our student veterans, and it's typically open during our office hours when we're open, but during the midterm or finals week, we have expanded hours. Some of the programs and the programs that I one of my roles, I oversee most of these programs. We call them our ACE programs: awareness, career readiness, and engagement. So some of those programs that we offer within there, all of our incoming student veterans, we have an incoming new student veteran orientation. We get information from admissions and the first year experience for transfer students. We reach out to them, and that's a time for our student veterans to engage with our other student veteran leaders, and also learn what the resources that we have available for you as a student veteran. Our career readiness programs, we have what's called Vet Connect and Vet Working that we offer once a semester. With Vet Connect, it's a way of connecting our veterans to employers. We have employers that come and they have to have specific jobs, and it's sort of like a speed dating type of a scenario where you're interviewing and having these mock interviews, and these employers are critiquing your interview, but also at the same time letting you know what you would be great to interview or to apply for, and kind of like to bypass that middleman or middle area where you're just sending a resume to your to the web or whatnot. And vet working is where employers are coming in to talk about job skills, salary information, creating your elevator pitch, how to change your resume from a military type resume to more of a civilian type resume there. We have various veterans activities during Veterans Month. During November, we plant one flag per UCF student veteran on Memory Mall, and we have a commemoration ceremony that happens during that time as well. And then also when our student veterans graduate, we have a reception in their honor where we have our graduation stalls, we have a keynote speaker, and we just want to take that time to honor your academic achievement. So we have those, and we have other programs that go along during that time too. But one of the main things that we also do is VA enrollment certification. We are not the VA, we are university employees, but so we're sort of like the intermediator. We're like the liaisons to the VA for you as well. We do academic and career advising. Many of the speakers today touched upon resumes, skills that are needed. Employers love to hear that we have veterans because the soft skills that you provide and that you bring to the table. Also, there was talked about things on your resume. One of my tips is look at your keyboard, the first 4 digits in the numbers. if you hit shift key, those are some of the things you want to touch on. Exclamation point. What did you do? What would get that attention? Where did you do it? Number 3, the number. How many people you supervise? How many people, how many projects did you oversee? And number 4, the dollar signs. How much money did you, if you were overseeing a budget, or if you had money transflow back and forth? Those 4 things employers like to see on a resume, and they talk about that numerous times in some of these activities. And we also do resume reviews, resume critiques, and things like that. We have a dedicated peer mentoring staff. These are all student veterans themselves who can assist with what classes to take, how those classes interact with your GI Bill benefits. And then we have an overarching student organization for veterans called Veteran Nights. It's two areas. Most people are familiar with Student Veterans of America, but the other side of it is Salute, which is the honor society for veterans. So they've come together to have one overarching organization. And I put some stats in there real quick to talk about how, since this is about health services and health information management, currently there's about 86 student veterans and dependents, but 59 of those are student veterans. And so those are the things that we're there to act as a resource. With the current staff that we have, we're small but mighty, but we have roughly well over 25 years of university experience. And we're connected. So if you have a situation where you feel like you're getting the runaround, we know who to call directly, and we can pick up those phones and call them specifically there. Some of the other responsibilities I have with not just programming and VA enrollment as a certified official, I'm also the community relations person. So I work with these, like Ms. Patel had talked about, I work with these veteran-based community organizations like Camaraderie Foundation, Team Red, White, and Blue, Mission Continues, the Association of the United States Army. I work with those to promote our student veterans to come in and interact with our students. So I also work with both mayors, Orange County and Orlando. They have Mayor's Advisory Board councils, and I sit on those as well. So a wealth of information that was presented to you today. Like I said, I want to be conscious of your time. And so I'm from the North and I talk really, really fast. I meant to say that earlier. But I'll leave it at that. And so if you have any questions, feel free to ask them.
Thank you so much, JJ, and the rest of the panelists. So now we're going to go ahead and head into the Q&A section. The questions that you guys have done in the chat, what we've gotten on our live chat, as well as a couple of other questions we've gotten privately. We'll try to get through them quickly. I'm going to fire them at the panelists. Some will be specific to certain panelists and some will just open to everyone, but we'll try to make sure to get to all of your questions. The first question we got this evening is from Catalina. This one I think is going to go to Deepika and or JJ. About opportunities. It says, my father is in the military and seeing him my whole life, I really want to make a career out of helping veterans. What can I do to stand out before and after graduation to try to land a job at the Veterans Hospital or somewhere similar? So Deepika, can you go ahead and answer that? Yeah, sure.
You know, one of the things that you want to do is make sure you have, like, your resume shows all of your work and experience. And sometimes, you know, like an internship, one of those options is a better way to get in, especially if you're not a veteran. It's harder to get in straight as a permanent employee. Right now, there's a lot of temporary jobs that the VA is offering, and it's a really good time to try to get in. And then I think the chances of that translation into a permanent position is there. And it's really just due to this pandemic situation. So there's lots of opportunities right now in the VA. We just keep opening up more and more positions. So I think right now is a good time to come in, you know, going into either an internship position. There's not a lot at this at like right now exactly in terms of internship, but coming in as just like an MSA, a medical support assistant, something, you know, that we're having a lot of need for would be a good start to build some experience.
Thank you. So the next question
I kind of want to add on
to
to that a little bit. You know, working for the VA a wonderful opportunity, and I work with them very much, and they work with the VARC as well. But also thinking outside the box. Like I said, I work with various veterans service organizations, Camaraderie Foundation, volunteer. Call them up and ask to volunteer for a couple of your hours at a time, because these organizations also have connections. If you're looking to get to the VA, if you're looking to get into one of the hospitals, or look in some other ways of health. So I would also add, contact some of these veteran service organizations and see if you can volunteer and network. There's a statistic that says 70% of all jobs are not posted. The art of networking is very critical in today's society. So I wanted to add that part on too as well.
Excellent. Thank you, JJ. So a similar question, but from a different perspective from Caitlin. I have been around the military as a spouse for the past 7 years. I've worked with the DoD, along with working at Homeland Security Solutions, Inc. I also recently just came back from Japan. I'm due to graduate this Saturday and finding it hard to find a job due to always moving around. Any advice? Especially because I wasn't able to do an internship due to COVID-19.
I'll go ahead and respond to that. I think one of the things I'll go back to again is use your resource, use your toolbox, as I always say. Look at your friends and family members who potentially are in there. Also, another good avenue would be LinkedIn. LinkedIn provides a free service for veterans and I believe military spouses as well, where you have a free LinkedIn profile. And then I go back to what I said earlier, reach out to the veteran service organizations to volunteer your time, get your face out there and build those connections with folks as well.
Thank you, JJ. We'll make this the last question just for the sake of time, and it's for
wait,
Shannon.
I'm sorry.
Go ahead, Larry.
I was trying to talk. I forgot I'd muted myself. One of the other things, I'm sort of assuming that Ms. Haig is new to the program if she just came back from Japan. One of the interesting things about the traditional MS program that we have, the one that's mostly face-to-face, is you will have a lot of working professionals as classmates. There's a large number of people that get into they're working in healthcare, they've got managerial jobs, they're working their way up. I always have to remember to raise my hands when I want to motion. And they're actually getting master's degrees because their company is paying for it and it is positioning them. But they will, that's actually a great networking opportunity. I would say, and Colin, you might be able to comment as well, that maybe a quarter of the students in the MS HSA courses are already working in managerial roles in healthcare in one way or another.
Yeah, they are. I mean, I actually noticed that a lot of my classmates were veterans or about to go into the military, but for the people that weren't, I noticed that there were a lot of classmates. I actually was just speaking to one last week. He's in management with Orlando Health. He's going to be graduating this spring. And he had just contacted me because he was interested in the reserves as well. But yeah, I had a lot of classmates. I think I remember in Dr. West's class, I think it was the fall of 2017, I had a classmate that I think he was a pharmacist and he was looking to get into management.
Yeah.
And so we had classes from all over. I remember classmates coming in scrubs. They were, LPNs, RNs, just looking to get that managerial experience.
Yeah, but we also had a lot of managers. Adventist Health seems to be well represented in the classes as well.
But what I noticed was what I thought was really beneficial for people that don't have so much experience or a whole lot of connections in the area was those classmates would they would get permission from the professor or from Dr. Nieves, and they would post different types of job postings if they were hiring, or if an employer in the area would contact Dr. Nieves, she would post it to all of the students. And I knew I had actually the first job that I got when I was around here was from one of those postings that I did for about a semester before I had started our OTC, and then I wasn't able to work a 9-to-5 job.
Yeah.
Thank you guys. So I'm going to just add one more on to that question. Another great resource is joining ACHE, or the American College of Healthcare Executives. They're super active in the Central Florida area and all over the nation. Since you're still a student, Caitlin, because you're about to graduate in 2 days, you're still technically a student, you do get a discount to join right now, and that'll give you a full year of access to some amazing networking opportunities and jobs for that. Colin, you want to go ahead and move to the next slide? So I just want to make sure everybody has contact information for our department, the Health Management and Informatics, to get more information on, of course, the program. And then, of course, access to our faculty, Dr. West and Shannon Ellswick. And then also contact for JJ's office, the Veterans Academic Resource Center. Super, super helpful. There's so much more information that he has for all of you, dependents, active military, and everything. And if you see in the chat, actually, a couple of them have put in their email already if you want access to that we can go through. The next slide, Colin. So that concludes this webinar. Again, we're here to help you for anything. I am one of the program coordinators for the Health Services Administration program, also for the online version that I know a lot of you are enrolled in, the non-traditional track and the traditional track. And we have several sessions coming up that are going to cover a ton more information, not only about health administration, but also informatics, statistics. A couple of them are going to cover some of the clinical aspects and COVID-19. So we just want to thank all of the panelists for being here today. Again, their contact information is in the chat. I'll leave it open for a minute so you can collect all that info. And